Hello, good afternoon, everybody. Okay, we're about to treat an interesting topic, so stay tuned and listen. So, this topic I'm treating HIV. I'm breaking down certain things that will help you live up to 100 years having HIV. So now, living with HIV, living healthy with HIV is my interest at this point. So, let's kick in. Listen and then get your papers, get whatever, get your record. I just listen. It's so interesting, so impacting. Do you know you can live with HIV without developing AIDS? Do you know you can live up to 100 years without having issues? Do you know you can mingle with friends? You can live your healthy life, have your children. Just what you need to hear now is what will help you carry on. Okay, there are several things. I break it into different stages. Okay, first one is breaking down what HIV means. Living with HIV and what it entails. Okay, so we'll go ahead, we'll know what HIV is. All right, let's come down to living with HIV. Living with HIV requires careful management, but with the right treatment and lifestyle, it's possible to live up to decades. It's possible to have your children. It's possible to live healthy without having this HIV, AIDS, blown rashes, and the rest of it. You have to live smoothly, live carefully, manage yourself. The first tip on it is medical management. Adhere to the treatment. Taking your antiretroviral therapy, the ACT, is an interesting one. It's the first stage you have to get interested in. It's another thing you have to put up as a priority. You have to be so much attached and interested in it. Regular checkup again. Regular checkup is another thing that will help you. But let me go back a little bit into that adhering to treatment. Adhering to your antiretroviral therapy, medication, and prescription to keep your viral load under control. The viral load is very interesting. Okay, very important. Make sure you're always checking it. Okay, regular checkup. Visit your provider, your medical provider, your healthcare provider, your doctor, your physician, all of them. All those people who have been managing, always take their contact, always ask questions, always visit the hospital, always visit. There shouldn't be anything shame. There is your life. Just kick it, always bag it up. So be very interested in taking care of yourself. That's the most important thing at this point. Okay, visit your healthcare provider regularly to monitor your viral load, your CD cell count, and overall health. Your health, your temperature, your liver, your kidney function test, and the rest of it, even your lipid profile, your cholesterol. These are the things that are supposed to be in check. Okay, viral load management. Work with your healthcare provider to adhere or achieve and maintain undetectable viral load. Maintain an undetectable viral load. This shouldn't be something that you shouldn't take care. You should be taking carelessly. You should work hand in hand with your health provider. Make sure your viral load is in control. This lifestyle change, you have to adhere to it. What do I mean? You have to adhere to eating healthy. You have to adhere. Hug your daily feeding. Hug it. Hug your fruits. Always adhere, make it your friend. Make it like if you don't take it, it's as if you're not taking water when you're thirsty. So your diet should be so much rich in fruits, vegetables, whole grains, and your lean proteins. You have to adhere to it. Regular exercises is what you need. You can actually do brick walking, you can actually do cycling, you can actually swim at least 30 minutes every day. Can you hear me? Get enough sleep. Aim at getting sleep at least 7 to 8 hours per night and help yourself get so much focus, get well balanced. Okay, another one is the management stress. You have to manage your stress. Stress has emotional stress. You have to manage your psychological stress. You have to manage emotional stress, psychological stress. You have whatever stress that you're going through. You have to be balanced mentally. Your mental stress, you have to balance it. And for you to balance it, start with sleeping well. It starts with eating well. Sleeping is another thing that will give you this balance and a concentrated level of life that will make you be so much productive and think well. Okay, avoid smoking. Guys, you have to avoid smoking. Ladies who like smoking as well, you have to avoid smoking. And substance abuse. Whatever substance abuse you do, you have to stop. Quit smoking, avoid using recreational substances. And they can weaken your immune system, you know that. It can weaken your immune system and increase your risk of complication. Okay, another thing you have to learn and also learn is like that. Like example I gave that you should hug your fruit as if you want someone that is thirsty that needed water and the person is already like I can't do without taking water. Now I'm talking about hydration. Stay hydrated. Drink plenty of water throughout the day. Help your body function properly. Your body cannot function without your water. You have this fluid, you need to take your water, you need to make your juice very well, but please be hydrated. Make sure you're taking enough water to detoxify your system. Wash your hands regularly, meaning that you have to adhere to keeping good hygiene. your hygiene, your environment, your armpits, you have to be clear. Always make sure your hygiene, your body doesn't have any space to accumulate any form of dirt that can actually go into the system to start bringing certain issues into your system. Practice good hygiene. Wash your hands regularly, especially during cold and flu season, to reduce your risk of illness. You don't actually need any disease around you. You don't actually need mosquito bite. You don't actually need whatever it is that can attract dirt into your system. You don't get vaccinated. Stay up to date with recommended vaccinations such as the flu shot and pneumococcal vaccine to protect yourself from infections. You hear that? Infection is not needed in your system. You see staph accumulation, you see E. coli, you see all those syphilis and the rest of it, having sex anyhow because you think you already have HIV. What else are you? You don't need them in your system. You have to stay well. You have to protect yourself. Build a support network. What do I mean? Surround yourself with positive vibes, positive energy, which will come from loved ones, friends, and support your group to help cope with emotional aspects of living with HIV. You know, I'm an advocate of this idea of living right, surrounding yourself with positive energy. Surround yourself with people who will help you be productive, live healthy, happy. You need happiness hormone into your system to help you live long. Okay, another one is the mental health and well-being. Seek counseling. How do you maintain your mental health and well-being? How to always seek counseling. We are there to help you. Your medical practitioners are also there to help you. So you have to seek counseling. Consider seeking counseling and therapy to address any mental health concerns, and such as anxiety, the depression and trauma that you are getting just because you've not gotten the information that you can live without having AIDS, and you can live and have your children, get married without having any complications. Just do the right thing and contact the right people, and the information just like you're getting will be so much digested into your system. And all you need to know is that you can live long, up to 100 years, and also live without having AIDS, and you continue to live and see your grandchildren. Okay, practice self-care. Engage in activities that bring you joy and help you relax, such as reading, listening to music, if it's spiritual music, or disco, whatever it is, taking your warm bath. Those are the things that will make you get so relaxed. Stay connected, maintain social connections, build relationship with others to help you feel supported and connected. Living with HIV requires careful management, but with the right treatment, lifestyle, and mindset, it is possible to live long and not have AIDS, and not die out of depression or out of traumas and the rest of it, by building tips or bringing up so many negative things into your mind that will bring you to commit suicide. So living with HIV is real. Living with HIV up to 100 years is real. Your diet should be your concern. Your being with supportive loved ones, your positive energy environment that is so hygiene, taking your therapies, taking your vaccination, and taking your viral load is things that will help you. So I pray you continue to click in so that you understand more and live right. Thank